If you can't, I have people who say they can't get on.
Okay.
Okay.
Okay. Hello, everyone. Hello.
Oh, we're live. Hi, everybody.
Hi, Dr. Lubin. We are live.
Hi, Janice.
How are you? So
I'm
good to see your
great.
beautiful face as always.
Aw, you
It
looking
looks
all
like we got the memo today.
We got the memo. Look at you wearing black and red lipstick.
I want to welcome everyone to our workshop. Today we are talking about a topic that is very near and dear to me. We hear a lot about fertility, and we hear a lot about birth control, and then all of a sudden, like everything stops until menopause, right? And you're talking about like the articles and education and just things that we are well informed of throughout the years. It literally is fertility, it is birth control, and then it's menopause. But nobody talks about what happens in between fertility and menopause. Nobody talks about that really strange in between time. It's like everything goes silent, and that is perimenopause. So that is what we are talking about today. I just want to introduce myself. My name is Janice. I am the branch manager at My Wellness Solutions. I have had the privilege of being with My Wellness Solutions for 2 years, and it has been an incredible journey. I have learned so much. I actually came from, therapies with children with special needs. And when I transitioned over to My Wellness Solutions, it's not so much adults with special needs, but it was really about a holistic approach and sort of like a therapeutic approach when it came down to adult wellness as a whole. And Dr. Sophia, you are a certified gynecologist. Tell us about yourself.
Well, I mean, I've been with My Wellness Solutions now, I think, I don't know, where are we going on? Almost 10 years now, if not more. I don't know, something like that. And it was just a match made in heaven. It's a great way for me to use the knowledge that I have as an OBGYN to really bring as you said, the holistic approach of how we care for women, whether that's in health, whether that's in beauty, whether that's even just in mental health, and bringing it all together. I currently practice in terms of my, routine GYN type practice at St. John's Riverside, through Symphony Medical up in Yonkers. And I just love being a part of the My Wellness team.
And we love having you. So a little bit about what we do. We are focused on, detox and weight loss and skincare, and a lot of where we kind of merge, right? As medical director and what we do as a holistic center is really encompassing just women's wellness in the area of fertility and hormones and on a holistic level, right?
Absolutely.
So we kind of cover like the full scope of one person at My Wellness Solutions. So when was the last time you recognized yourself in the mirror? I want to quickly share my testimony with you guys. I know that we have a lot of women kind of like in the mid 30s range that registered for this workshop. So I know that what I'm about to say will resonate with a lot of you. I know that for me, it was waking up one day. I was kind of like in 36, 37 years old and really just not recognizing myself. It was really just like everything that engulfed who I am as a woman, down to how I felt about my reflection in the mirror, my energy, and just that zest for life was kind of just gone from one day to the next. And I'm not a depressed person, So it wasn't like I was able to put my finger on any type of ailment like depression or anxiety because, like, hello, like I've never had depression, I've never had anxiety, like that was crazy. But I knew I didn't feel like myself. And I know that working here was just a godsend because I remember it was you, Dr. Lubin, who was like, girl, you need to get your blood drawn. And lo and behold, I found out I was in perimenopause, and then all of a sudden it made sense. All of the symptoms that I was having, um, my inflammation was through the roof. You know, my blood work was all over the place, and we really started taking care of myself as a woman through what we're going to talk about later in the presentation to really get my perimenopause under control and really just give me my life back. Do you have anything similar, Dr. Lubin, in terms of like any stories of a client or a patient that you've had recently that you can say like this was wild?
Honestly, I think every single day I have a testimony, quite frankly, but I'll say this, you know, on average, women are feeling so many different symptoms, and they'll go to their doctor, and whether it's their primary doctor and even sometimes their OBGYN, and yet they'll be told, well, they need to see a rheumatologist, or they need to see a neurologist, or they need to see a psychiatrist, or they
Right.
need to see a GI doctor, or they need to see an endocrinologist, and they have to see so many different people because of all the different little symptoms that they're having, and no one's putting it together that all the things that they may be experiencing may actually be linked to their hormones or the hormone fluctuations that they're having in this transition period called perimenopause. And so that's the hard part of going through this type of transition because um, no one can always, you know, it's like you can't find the person who can really put it all together and then give you, as you said, that holistic approach so that all of your little things can be addressed. And so I look back at a friend of mine who actually is a physician, and she was, you know, she came to me, this was like at least 3 or 4 years ago, and said to me, oh my God, I can't sleep. Oh my God, I'm having, you know, like, I just can't sleep. It's driving me insane. And I just feel so irritable and emotional. And, you know, she's like, this job is just too much for me. I can't do this anymore. And every day we were having this conversation, and I would say, I think it's your hormones. I think it's perimenopause. I think this is what's happening to you. She's like, what are you talking about? I don't know what you're saying. And whatever it is, it doesn't matter. I'm never going to take hormones, and I'm never doing this, and I'm never doing that. And I eat, all I eat is salad. So I don't know what you're talking about. I eat well. And I was like, I know you eat well. So if you're eating well and I know you exercise, there's more to it. And after 3 years, she was like, all right, give me this stuff. I don't know. Do something for me. And it has just kind of completely changed her thought process, her feelings, her connection to people, her relationships. And she's like, why didn't you do this for me sooner? And I was like, it's only been 3 years.
Right.
So it's a
So
good thing to understand that all the things that you're going through and even the fear of what you're going through and how to manage it is all normal. It's all a part of the process. And that's
absolutely. So we're dealing with fatigue, we're dealing with anxiety. How about no sex drive? You know,
yeah,
get
that's a
to a
big one.
certain age and there's just no sex drive. And women are young enough in their late 30s, early 40s to where I think it's even embarrassing to talk about because they think it's themselves. They think there's something wrong. And there is, but not what they think it is. It is perimenopause.
Definitely.
So let's define perimenopause. It is, like I said, just a very strange time in between the fertility and menopause. You're no longer producing hormones in like that cyclical manner that we teach our clients about. And there's just like extreme fluctuations in hormones that causes you to feel crazy. You know, and it's women in perimenopause that really have like that depression. They're going crazy on their kids. They're ready to quit their job. They're ready to get a divorce because they no longer have
They just
like
don't feel like themselves.
yes, 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 yes. And the thing about it is that the symptoms can appear 15 years before actual menopause starts. So imagine 15 years of untreated, unspoken, just all these things happening for so long and nobody's talking about it. These symptoms are often confused and dismissed as PMS because doctors are not, very well versed or very well educated on perimenopause symptoms. So, it's like, oh my God, my breasts are super, super, super tender and this has never happened before. And all, that's PMS. And you walk away and you're like, I've had PMS all my life and this is new. But we're just gonna rush it under the rug like everything else, right? So this process can begin as early as mid 30s, and it's very, very important that we are aware of it so that we can be better, we can feel better, we can strive, and we can get ourselves back under control. So, what are your thoughts, Dr. Lubin? How can you help us understand, just the hormones that what's happening in our bodies during perimenopause?
So, what is perimenopause and menopause in itself, right? We need to understand the concept of a transition period that gets us to the point where we are in quote unquote full menopause. Menopause being when your period stops for consecutive 12 months. And we usually say that that can happen anytime after the age of 40, but on average, that happens around age 51, especially in this country. So, but like you said, even as long as 10 or 15 years before you actually get to that very last period, you can be experiencing all these changes that are happening that are very similar to menopause, but you're still getting your period. And even in fact, your period can be coming even closer together. So you may be having your period every 3 weeks when you were a person who always had your period like to the T on the day every month. You may be someone who's experiencing a period that's coming every 45 days, every 50 days, and then it comes back to every 23 days or every 24 days. Like it just becomes this really like sporadic thing. And basically what's happening, it's these really big peaks and highs and lows and highs and lows that's happening with your estrogen levels and other hormones that support you, that is really causing those perimenopause symptoms. And that includes all the symptoms, including like bone pain, joint pains, includes changes in your gut and all the other things that can be happening. And we have to understand, what are our hormones? Hormones are these little chemical messengers. They go into the cell and they tell the cells what to do. And when we think about hormones, let's say, especially things like estrogen, that have 400 functions in the body.
That part.
That
400.
400. So if you are having big fluctuations in these little chemical signals, I should say, that tell your cells what to do, then yes, it's going to feel like you're crazy. But let me tell you, I'm the one who's here. You are not crazy. Your body is going through a crazy time.
I want to know, all of yous in the comments, let me know, how are you feeling? If Dr. Lubin or I have said anything that is starting to resonate with you, please chime in the comments and let us know. I want you to know that you are not alone. Period.com. You are not alone, and we are absolutely here to help. So, normal labs doesn't mean you're not in perimenopause. How many of you feel like you start to go to the doctor because things start to change for you, and immediately they go for the labs and they tell you everything is fine? When we have our hormone consultations at My Wellness Solutions, we are always looking at the whole picture. We understand that symptoms and labs will tell us an entire story, not just the one thing. The truth about perimenopause and the healthcare system is that, number one, 35% of women over 40 say their healthcare provider talked to them about what to expect in perimenopause. Dr. Lubin.
I know. Only 35%
Can
of
you
women.
chime in on those cousins?
And I don't even think it's that high. Right, right. I don't even think it's that high because for the amount of people that I see on a regular basis who are like, what are you talking about? What's perimenopause? Or, what else am I going to get other than hot flashes? I don't have that. Or when I say, well, these are some of the changes that you can expect when you're going through XYZ, and they're like, you're the first person to ever say something like this to me. And so it makes me even think that even the 35% of women who say that they had a healthcare provider talk to them about it, it's like, and what did they say? What did they give them in terms of information? And the fact that in reality, even myself included in my residency, it was maybe one lecture, maybe two. There was no in-depth. We talked mostly about the Women's Health Initiative, and how probably not to really dive into hormones, hormone replacement, etc. So it's frustrating that, the discipline of the thing that we're supposed to learn when we're in training was kind of glossed over, and so it's only those of us who really, really seek out help, how to educate ourselves better so that we could better help our patients, because our patients were coming to us, right? And not being able to really solve their issues, at least for me, is what drove me to do a deeper dive to make sure that I could understand exactly what was going on so that I can have a better idea of how to help them,
And that glossing over is the 29% of OBGYNs that are receiving training. It's literally the glossing over. So it's not even in-depth training.
Right. And then I think what happened too, I think in the 2000s, especially when the Women's Health Initiative came up, it really made it harder for practitioners and people in training to get that real in-depth look at how to treat women in terms of menopause. Instead, we were being told, well, this is just a period in a woman's life, as if it was just a one-time thing, like it just happens all of a sudden and then that's it. Once it happens, you just get over it. They don't realize that it happens and then you have to live through it for the rest of your life. Menopause happens and then you live the rest of your life in menopause, So it's not to say that you always have all of the symptoms, but we have to remember, if you stop getting your period at 45, so you had about 30 years maybe of actually getting a period, right?
Mm-hmm.
Well, I want you to live till 90, 100, and I want you to live that vitally. And so that means you're spending more of your life in the menopause, So it's fortunate that we learned to live in that time as vital as we could.
Yeah. It's very important that we start now taking control and taking back our lives and saying, no, we don't have to live this way. We can be educated about our bodies. We can know exactly what's going on and know how to protect it. In women who are premenopause, the average range of estradiol or estrogen is between 330 to 400, depending on where you are in your cycle. Now, FSH is something that I know a lot of women, when I go through their labs, they're like, what the heck is that? The FSH is what helps control the menstrual cycle by triggering egg growth in the ovaries and preparing them for ovulation. So a woman who is premenopause, her FSH ranges between 0 and 21. Now that changes in menopause. In menopause, that range shifts from 25 to 135. It's pretty high.
That's correct.
How did I do on that, Dr. Lubin?
Great.
Oh, so I can go in the hospital and assist you?
Girl, you assist me all the time. I can't do
it. Well, thank you. So your estrogen levels in menopause is 0 to 29. But here's the thing. In pregnant women, estrogen can go high into the thousands. Now, to give you guys a full scope of what the heck you are going through right now, think about a woman in menopause whose estrogen can be as low as 0. A woman in her pregnancy whose estrogen can be in the thousands. And a woman in perimenopause can experience everything in between, from zero into the high highs at any given moment. So you tell me, how is it that normal labs during this time means you're not in perimenopause?
So
They
that
just happen to draw you on the right day.
is the biggest problem actually we have when it comes to perimenopause. The biggest problem we have is that there's these constant highs and lows that are happening, but the labs themselves overall, like your FSH will still look normal. Your estrogen will be in that range, right? You can have a range, have an estrogen that's like, let's say, 300, okay, and your FSH is very low. And so your doctor will be like, well, what are you talking about? There's no way you're in menopause or even perimenopause because you have high estrogen levels and your FSH levels are low. When we think of menopause, we think about very high FSH levels. But it's really the fact that you could be at 300 today and be at 50 tomorrow. And that fluctuation that's happening and those rapid changes is what causes the problems that we suffer through during that perimenopause phase.
We have a question here. Myra's asking, what about if I go into perimenopause right after giving birth? This is a really good question. We were actually talking about this just recently. What should I expect, and is it safe to have babies?
So actually, I love this question. I actually was talking to another patient of mine recently regarding how postpartum can mimic perimenopause and menopause. Why? Because especially a woman who's breastfeeding, your estrogen levels plummet. They go all the way down in order to give prolactin an opportunity to go up. Prolactin is the hormone that actually helps to stimulate the breast and stimulate lactation, etc. So what's happening? All of a sudden, you're in your postpartum period, and what happens? You don't really have a libido. You may experience vaginal dryness. You may experience irritability, depression, right?
Mm-hmm.
These are all things that can be
real depression. It's hormone driven. It can be fixed.
Yes. Yes. So actually, perimenopause and menopause can very much mimic what's happening to you post-birth or in the postpartum period.
Mm-hmm.
And so that's one aspect of that question. The second is that in perimenopause, is it safe to have babies? This is a big issue. When I say it's a big issue, this is the first time often that women even come to recognize that they may be in perimenopause because they're having fertility issues. Because when they're like, well, I'm finally ready to have a baby. I'm 39, I'm 41. And it's difficult. Why is it so hard? I'm still getting my period every month. What's happening? Aren't I ovulating? And yes, you're ovulating, but you're still going through these big fluctuations. And that is what's leading to changes in the level of the ovary that changes the amount of eggs that we have. And so, yes, it is problematic. Is it safe? That's a deeper dive. I will say that women should be able to have babies, with the modern technology and the things that we have available to us. You can have babies basically well into your perimenopause phase.
Very insightful. Thank you, thank you, thank you. Now we are going into a key hormone here, estrogen. Dr. Lubin, take it away.
So there are three types of estrogen: estradiol, estrol, and estrone. So these are the three types of estrogen that are always working in our bodies. Sometimes we have more estradiol in our reproductive phases, estrol when we're in pregnancy, and estrone is the more predominant estrogen when we're postmenopausal, right? But the bottom line is that it's the dramatic changes that happen in estrogen that really lead to the dramatic changes that we're feeling in our bodies. Okay. Like I said, estrogen has over 400 functions in the body. It mitigates things like the hot flashes. It controls bone density. It helps preserve our memory. The way that estrogen works at the level of the brain is so expansive. Okay. The way that it works on our skin, it's why we start to notice really an increase in things like wrinkles and dryness of all of our skin during the time of perimenopause, menopause. And of course, again, what it's doing in our brains, estrogen helps with serotonin, dopamine, all the happy hormones. We need estrogen for those happy hormones. Okay. What it's doing for our gut. Oh gosh, I just can go on and on and on. It does so
I think
many.
you like you some estrogen, Dr. Lubin.
I love estrogen. I think it's great. Anyway, um, the benefits of optimized estrogen, right? So better sleep quality, alleviates vaginal dryness and discomfort associated with sex, right? Things like your skin, your hair, your nails, preserves your memory. The women out here who are feeling things like brain fog and low libido and just mood changes can all be related to your estrogen levels. And estrogen in and of itself, at the right level and balance in your body, is an anti-inflammatory hormone. Okay. And it's a part of the reason why, while we're in this perimenopause transition, it's these constant highs and lows that leads to what we call estrogen dominance and the inflammatory response that we get from that. But understand that truly estrogen is meant to be an anti-inflammatory hormone.
Testosterone. Thank you so much for that. Now, testosterone is that girl. I
This is
love
that girl.
testosterone. Now, I can say that because there are so many women who just don't know that testosterone is not just for men.
We have more testosterone in our bodies, actually.
Yes. 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 And it is such a vital hormone for women to have and to function and to feel great and to just be able to work out and do all the things that that really it's what it does for men, but on a woman's scale. And it's just amazing. It's amazing. Take it away.
Okay, so testosterone. Of course, we know testosterone as the key hormone for men, but it plays such a crucial role for women as well. So it plays a role at all levels in our bodies, okay? Very similar to estrogen. It's working on our brains, it's working on our breasts, it's working on so many different things, including libido, muscle mass, how we feel in terms of mood, stabilization, and things like that. So we have the maximum amount of testosterone production is usually between our 20s and our 40s, but we start to lose it just like men do. And we lose it dramatically in the perimenopause and menopause transition. And so that loss of testosterone can lead to things like fatigue, things like, again, the whole mental fog, changes in our mood, just our body and our body mass. We just don't realize how testosterone depletion is having just as much a response on our bodies as our estrogen depletion.
Let's talk about some of the benefits.
Ooh, I love the benefits of testosterone. Okay, mental clarity, improved concentration, sexual drive and desire. Let's see, just an improved sense of vitality, testosterone is also going to just boost your sense of performance. It literally boosts your confidence,
How
helps
about the effects at the gym?
Right, exactly. That's exactly what I'm saying. That it's just going to help you feel like you can power through your workout, for example. The benefits include better sleep. Okay, so many of the things that estrogen is doing, testosterone is also doing, and you need them in concert.
Let's talk about the thyroid. We love her. We need her.
I love thyroid. Why do I love thyroid? Because thyroid helps. Just imagine you always need something that's kind of working in the background, okay? And that's kind of pulling everything together. So just imagine your thyroid is the hormone that helps all of your other hormones, no matter what they are in your body, to work even better, okay? To work optimally. And when your thyroid is not working, well, everything else is going to hit the floor. That's the bottom line. And so thyroid is regulating your metabolism. Thyroid is regulating your body in terms of temperature. Thyroid is regulating things about your heart rate, helps with growth, the development. And like I said, all hormone balancing. So
what would you say is optimal?
So here's the thing when it comes to thyroid, especially when we go to like see our regular doctors, what happens is that they look at one little thing called TSH.
Mm-hmm.
And TSH they use that as the screening tool to say, oh, your thyroid's working fine. The problem is that it's not looking at active form of thyroid in your body. And so when we look at the active form of thyroid in our body, it's just a matter of understanding, do I want to be low normal or do I want to be mid or high normal? And when we talk about optimization, we really want to be on that higher part of this little bell curve here. The goal of being optimal is to be on the higher end of, at least middle for sure, and even a little bit towards that for my hand, it's to the right, but probably for you guys looking, it's to the left. But the bottom line, it's to be a little bit on that higher side is what I'm talking about when I say optimized.
Mm. And this is why it is very important that we are, doing labs, and really checking for these optimized levels. I encourage, all of our clients to definitely, make an appointment with us. Let's check your hormones. Let's see what's going on. The doctors are not checking what should be checked. They're not checking that T3. They're not really looking at the full scope of where your estrogen is and where your testosterone is. I've had women at a 2 with testosterone, and the doctors tell them, you're fine. Absolutely not.
Absolutely.
I see a woman at a 2, I'm booking an appointment for pellets or for, whatever it is that they need. I'm booking an appointment because at a 2, you're fine.
You're not fine. That's not when they came to us in the first place. And let me tell you, I just want to answer this one quick question. So does testosterone make women masculine? In the ranges that we are giving, that first of all, women, like I said, have more testosterone per capita, right? That's the bottom line. So no, it's not making them more masculine. You're not getting a deeper voice. You're not, just running around looking like a man. Because
I don't look like a man, do I? I'd like to think
not. No. So it's not a matter of it making you more masculine as much as it is a matter of keeping your testosterone for your body at a level that helps you to have the best performance and to be considered what we call optimized. The goal is not to make you have hormone levels that put you over the edge, that make you have that deep voice or, all the other things that we may associate with masculinity. Let's just say that. So no, I just wanted to address that question.
That was excellent. Excellent question. So let's talk about hormone replacement therapy and just how something so small, just one quick decision and a small shift can change your entire life and literally how you go through the rest of your life, through the peri and the meno, and live through that.
So in terms of hormone replacement, when we're going through this perimenopause and menopause transition, hormone replacement is definitely something to be considered always in our toolbox. Okay. We need to stop thinking about hormone replacement as if it's like, the way it was taught to us, even myself as a doctor, right? That somehow it's going to make me have cancer. It's going to make me have blood clots. It's going to make me have this and that and the third, without actually reviewing how hormone replacement, especially when given at the right time, and that right time is the perimenopause, early menopause time, because we want to just get us to the point where we're back, instead of having this craziness happening, we're back to coasting with our hormones. Right?
I like coasting.
Like coasting. So that way we're coasting back through our lives. I recently saw an Instagram post of a doctor who was talking about the fact that so many of our hormones we replace, okay? Because we are concerned about the disease that can be caused by having deficiencies in those hormones. Which hormones am I talking about? Insulin, for example. You have a deficiency in hormone, what do you have? Diabetes. You have a deficiency in thyroid hormone, what do you have? Hypothyroidism. And we don't let people live with those deficiencies. And yet when it comes to women, right, we just simply accept, oh, but you got to go through menopause. It's just a natural transition, blah, 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 blah. No, we need our estrogen too. And if we're given estrogen at the right time and that is continued, okay, it allows us to live a more vital life. So when we talk about hormone replacement, yes, it may not be necessary for everybody. And yes, it may have its own risks and benefits. That's an individual conversation, but it shouldn't be something that we're afraid of. We should all be at least having the conversation. And there's so many different ways in which we can get our hormones replaced. So, like in the slide right now, there's a pill portion, there's a pellet portion, there's a patch, there's a cream, there's intravaginal estrogen. Okay, and those are for to address different things for different people. You know,
So you're saying that estrogen isn't just delivered, well, obviously, that's not just delivered the one way. We have alternatives. It doesn't have to be a pellet. It doesn't
yeah.
have to be a patch. So women have options.
So women have options. Women definitely have options. And it's understanding that we have options is where we can see what's going to be better for us, right? What's better for me as an individual? What's going to help me? If I'm someone who has, let's say, I don't know, high blood pressure, which type of hormone replacement may be the better form for me is going to be different for someone who doesn't have high blood pressure or who doesn't have vaginal dryness as their main symptom, you know?
These individual needs is exactly why consultations are necessary. This
100%.
is why we do hormone consultations. This is why we sit down with our clients. The most frustrating thing for me, as someone who, just like everybody else, went to a regular doctor and whatnot, is never getting the call to go over what would be normal results. Because if you had normal results, you never got a call from the doctor, ever. You would get the results in your inbox and it was up to you to figure it out. We don't do that to our clients. It's like we draw your labs and we're going to sit down, we're going to schedule a hormone consultation. We're going to go over where you can benefit, where you can achieve optimization in your hormones, right? And address those things, particularly address your symptoms, address any ailments that you may have, so that we know that you are taking the educated and best approach for yourself.
That's correct. And then the other thing is that unfortunately, when it comes to lab values, right, especially if you get a normal lab, so then it's as if your symptoms just get tossed out the window,
Yeah.
And I think that that's where we're really making a big mistake when it comes to how we're taking care of our patients, just in terms of the overall approach in medicine, in our healthcare system, is that when it comes to actually how patients are feeling versus what we may or may not be seeing in their labs and really trying to approach them that way, this is where we have the problem. Testosterone. Ooh, testosterone. Okay. For us, we love testosterone and we love testosterone delivery via pellets. Why? Because it helps us to have kind of like that. It goes up and then has that real like steady state in terms of the testosterone. So there's many different ways of which you can get testosterone, but one of the ways that we really like is the fact that we get a chance to give it one shot through a pellet. It goes just underneath the skin, and you just need to get it every 4 to 6 months, depending on how your body's using it and how your symptoms are, et cetera, et cetera. And it's a very, very quick procedure.
And I believe we have a question.
Ooh, okay. Let's see.
It says, my doctor said that testosterone replacement therapy is dangerous because it sends messaging to the body to no longer create testosterone naturally, which causes dependency on the therapy. Is that true?
So we have to think about the fact of where you are in terms of testosterone. So are you going through what we call andropause, right? So are you going through the point where the testosterone, your natural testosterone is low? Your body is actually not making enough in order to keep your body optimized. So like I said, it's, the thing is that when we know that testosterone, for example, is protective for so many other parts of the body, okay? And so when it's low, all right, how else are we going to get it back up, right? And there's more to it. It's not just testosterone therapy or testosterone replacement, but most people are not actually doing the work in terms of how to naturally increase their testosterone. And even if they are, it's still not getting it up to the levels that they need.
Awesome, awesome, awesome. So we do have one more question. And we have, how do you know if you're deficient in testosterone?
You need to check. You need to get labs done. It's that simple. It's literally going in to get your labs done.
So, in addition to relieving your symptoms of perimenopause, hormones also protect your health. Ladies and gentlemen, I just need to drive this point home before we go into protection, because this is kind of like long term. This is where it's at. You know, it is so important to know where your levels are. It is so important to know for the preventative aspect of it, not just the feel good. And this is what I tell my clients, listen, yes, it has all of these benefits to make you feel great. But what about the preventative aspect of it that you're not thinking about right now? If I could talk to the 16-year-old version of me, I would be telling her about all of the preventative things to be doing so that when I was at 35, I wasn't feeling so crappy. And so this is why I drive this point home with, and especially with you guys here online. Get your labs done, know where you are, and take the steps necessary for not only how you feel today, but where you're going to be tomorrow.
10 and 15 years from now.
Yeah.
Yeah. So let's talk about it. All right. This is one of my favorite slides, and I'll tell you why. Because it just brings home the point. Premenopausal women die of heart disease 1 in 7. After menopause, that number drops to 1 in 3. What is that telling you? It's telling you that the protective effects of our hormones, once depleted, then boosts and increases our risk for heart disease and heart attack. Okay? It's the reason why women, we have the protective effect, right? We don't really see women having heart attacks until after age of 50. Why? Because that's actually after the menopause. Okay? Also, breast health. Oh my gosh. Again, the biggest myth is the fact that, hormone replacement, it's going to have all these detrimental effects in terms of causing breast cancer. Actually, even in the Women's Health Initiative itself, the biggest study that really drove the concept of the feeling that, oh my God, hormones are going to cause breast cancer, showed that in the estrogen alone arm, that there were absolutely no change in breast cancer risk. And in fact, those women who were on estrogen, even if they did develop a breast cancer, it was a less aggressive cancer. So that's a big point. All right, bone health. The protective effects of estrogen and testosterone on our bones is bananas. That's the reason why, again, we think about osteoporosis. Osteoporosis is a major problem for women having gone through perimenopause, menopause, because we're no longer having the protective effects of those hormones on our bones, growing normal bone, not depleting it, and also, of course, taking our right supplements, etc., weight-bearing exercises. But what our hormones, the protective effects of our hormones on our bones is major. And I can't talk enough about the brain. I don't want Alzheimer's. I know I don't want dementia. I know I want to keep and have all the protective effects on my brain and how it functions, whether it's my mood, whether it's my memory, whether it's my focus. I want all those things to always be working at the right level. I do not want to live the rest of my life on the end, during the ending part of my life, in that feeling like I'm anxious. I don't know what's happening. I don't want to go outside. I don't want to be with people. I'm depressed. I don't remember. I don't want any of those things. So that's why I'm so thankful that I understand what happens with hormones and how they protect us. So women suffer from Alzheimer's at a ratio 8-1 compared to men. Women with estrogen have a 50% lower likelihood of developing Alzheimer's. Again, just what estrogen is doing for the brain is amazing. Again, our heart health, the benefits of estrogen, testosterone, and many of our other hormones that work in concert, our thyroid, all of those things in terms of how they're helping our heart health, our breast health, our brain health, our bone health, things like lowering our cholesterol. I don't know, there's so much.
Thank you so much for that. I'm tagging myself in now. You can take a sip of water.
Great, thank you. Here we go.
I saw you just get a little dry. It's okay. It's okay. So it's not all about, hormone replacement therapy. When it comes down to my wellness solutions, when our clients are walking in, we are helping you connect the dots for you. Your labs and your symptoms will help us tell you what your body has been trying to tell you for a really, really long time. I think that we may have another question. I think it was the one about inflammation, maybe. Just looking for it. She's there somewhere. But we're gonna find that question because it actually pertains to what we're talking about right here, right now. It starts with what you eat. An anti-inflammatory diet, intermittent fasting, and good supplementation is so important to keep the body thriving with hormonal balance. It's not just about, yes, you're going to get the hormone replacement, but how are you supporting those hormones? How is your body in harmony? Anti-inflammatory nutrition, the main targets are the gluten, the dairy, the refined sugars. We're talking about, when we're talking about intermittent fasting, we're talking about fighting cellular inflammation by reducing stress to the cells. Intermittent fasting is so important. It actually causes cells to regenerate. It will break down damaged cells in your body. Those damaged cells are what's responsible for building up all of the inflammation. So when those damaged cells are broken down via intermittent fasting and regenerated, now you have brand new cells with all of these, it's like these little messengers that are going to every single portion of your body, doing what it's supposed to do, as opposed to just sitting there dormant, dead, and causing all of this crazy inflammation in your body. I hope that answers the question. Inflammation is cellular inflammation in the body. And intermittent fasting helps bring everything back into balance. Dr. Lubin, your feedback. What do you, I know that you're passionate about intermittent fasting.
I am passionate about intermittent fasting, but it's only because, you know what, I think I've always been an intermittent faster. I didn't even realize that that's what I was doing all my life, just because of the kind of go lifestyle that I have. And so I always ate kind of like between these little windows and things like that. But I think it's just understanding, and it may not, again, everything is not for everyone, right? However, if you can at least start to implementing some of these things as a part of your holistic, again, we go back to the holistic approach on how we deal with ourselves and how we, of course, here at My Wellness Solutions deal with our clients, is the concept that it's not only one thing. It is definitely how we're eating, how we're working out, how we're eating, when we're eating, what is our exercise routine like, what are our supplements, what else are we putting into our body in order to support our bodies, right? And in terms of a healthy way and a healthy lifestyle. So there's so much more to it. And in terms of the inflammation, I mean, inflammation, sometimes people think about inflammation, because of inflammation, I have joint pain. Because of inflammation, I may have problems with my gut. And those are all true. Inflammation is just imagine like swelling, but swelling at the cellular level,
By the time it gets to your joints, it's already gone too far.
Absolutely. There's no question about it. Swelling at the level of your gut. And not allowing the right bacteria to grow and thrive and do the things that it's supposed to in order to keep us healthy. So you were going to say something?
Yes, you said something very key. You said that the same thing doesn't work for everybody. And that is absolutely true. It's like a lifestyle, nutrition, and all of that. It's not a cookie cutter situation for
No,
everybody.
no.
That's why the consultations matter. We dig into your lifestyle. If somebody when somebody walks into my wellness solutions, the first thing that they're going to do is fill out an intake form. And what does that intake form consist of? We want to know what's your lifestyle. What are your hours that you work? How do you eat? What do you do for fun? Why? Because when it comes down to how your body is processing minerals, nutrients, vitamins, all of that matters.
Yeah. How do you sleep? When do you
What
sleep?
is your sleep cycle? What is your workout cycle? All of this matters. But it's such a comprehensive intake that we do at My Wellness Solutions, because we want to make sure that we're not putting somebody who should not be on, let's say, a fad diet. We're not going to put you on a fad diet if that's just something that's not going to work for you, based on what we're finding out about you via your forms, your lifestyle, what your symptoms are telling us, and what your labs are telling us. All three things matter when it comes down to one
Absolutely.
person.
Absolutely.
So it starts with what you eat, and it goes into how you supplement. Um, you know, the, at the end of the day, we know that there is a big diet and nutrient gap. Um,
Especially in this country.
because despite, our greatest efforts, and I know clients who's like, I eat great. I don't know why
I'm
I'm
gaining weight.
so deficient. I am like gaining weight. And at the end of the day, um, our foods are lacking essential nutrients due to, or rather, we're lacking essential nutrients due to overly processed foods, agricultural practices that are just leading to poor quality soil. Our fruits and vegetables that are so healthy is coming out of this poor quality soil.
Yeah. The
So we're
pesticides
not
that we put
getting.
on it and all of the what we call hormone disruptors, the things that actually mess up our hormones just coming from the foods that we eat.
We are.
So
Mhm.
we have a question. Why isn't this a normal protocol seen and addressed with general practitioners? Our healthcare system is unfortunately very broken. We are not allowed to spend the kind of quality time that it really requires in order for us to dig deep and get to this kind of information. I don't know if your general practitioner is asking you, how are you sleeping? What are you eating? When are you going for a bike ride? What time? What are your relationships like? What else is happening at work? And really doing a deep dive into who you are. But that's what makes the difference. And then also understanding all the little nitty gritty that does happen in your labs that can show us, and sometimes doesn't, but then goes back to symptoms. What exactly are you feeling? And unfortunately, in the healthcare system as it is today, there just isn't enough time allowed for that. Or even in teaching and education, medical education, we're not necessarily teaching that to our future doctors.
So good. Thank you so much for that. Unfortunately, we are so deficient in very crucial vitamins and minerals in our society now. Vitamin D, it says 42% deficiency rate. I think it's more. Why do I think it's more? Because I can count on one hand in the past 2 years that I've seen someone come in through the door with a normal vitamin D level.
I know, it's crazy. Crazy.
It's insane. And the thing is that vitamin D is crucial for your bones. It's crucial for your immune function. And
Yeah,
your
vitamin D,
like zero.
it helps, it creates, so vitamin D actually is a hormone, right? Like it's a
Yes.
pro-hormone. I know we were talking about this. So, it's funny that again, something that has such a dynamic effect in our bodies, um, just doesn't get enough play with all what it's actually doing and how a deficiency in it can cause disruptions in our bodies. So that's true to many pills. You're absolutely right. But unfortunately, the American diet just doesn't provide us with the vital nutrients that we actually need. That's one. And then two, getting vitamin D, the conversion through the natural sunlight. We simply just don't get enough sun.
Or how about the sunscreen? You're not going to get it anyway because we're lathered in sunscreen from head to toe.
We're going to get into so many rabbit holes.
We're going to catch up in the summer because it's not happening.
We're going to get into so many rabbit holes. So I just think, you know, we need to just understand that supplements are very important.
Very, very important. Vitamin B is crucial for your brain, depression, all the things.
Yes.
Thankfully, we have, I want to say whole supplements, meaning they're not full of fillers. They're actually very pure. Pure is the word, is a better word for the BioT brand of supplements that we have. One of our main ones that supports a whole lot with the estrogen and the testosterone and just keeping everything in its pathways is DIM. This is, it truly helps promote healthy aging, enhances overall wellness. It's just a very good supplement to have, especially when you are considering the estrogen, or rather the hormone replacement therapy. And even before that, I think that when it's like you said, when you have really high estrogen dominance, right? DIM is essential to be taking when your estrogen levels are so high. Why?
Yeah, why? Because it's just going to help your estrogen instead go through the normal pathway and take away some of the actual toxins that can build up from the degradation of hormones. So that's the point of why we would take something like DIM. It just helps all of our hormones that are working for us, but work in their normal pathways and taking away all of the things like toxins and things like that that can build up with hormone processing and metabolism in our bodies.
And then we have, again, for our vitamin D deficiency girlies, like me, or was rather, we have vitamin ADK. It is very important to have vitamin A and vitamin K when you are taking vitamin D, because it helps to absorb the vitamin D onto a cellular level. I personally advocate for this. When I do my hormone consultations with my clients, I actually show them my labs, because the proof is in the pudding, baby. The blood don't lie.
That part,
blood don't lie. I was like negative whatever in vitamin D, and 3 months, I went from like a 14 in my vitamin D, and I shot up to like a 75,
which is right where we want you to be.
That's a sweet spot. But it was just taking this. Now, mind you, I have been prescribed vitamin D. Prescription never shot up that high, no matter how much I was taking it. But this sucker right here is the truth. Iodine for thyroid function. Anybody online that have like Hashimoto's, or you know, just an overactive thyroid, or even an underactive thyroid, this has selenium in it, which I know that if anybody has Hashimoto's and they've gone down that rabbit hole, you've heard about selenium. Can you talk to us more about the benefits of iodine in the thyroid?
It's just going to help the active forms of thyroid hormones work better. It's a cofactor. What does that mean? You need something to attach to the hormone to just make it, to continue to keep it active and be in its active form. So that's just what it's doing.
And then we have our yes, this one right here, our multi-strain. And this one, oh man, she's so good. She is, so you feel her working. That's the thing. I've taken a ton of probiotics like all of my life. This one I actually feel like you can tell the way like your digestion is going, how you feel in your gut. It's just so good for gut health and a strong immune system and keeping everything pristine, if you know what I mean. We don't want imbalances, girls. We don't want imbalances. That leads to other things. Best night's sleep. Oh my lala. Perimenopause and not getting a good night's sleep is a thing, okay? Because you go to sleep cold and then you wake up in the middle of the night hot as heck. Maybe not sweating, but you're definitely doing this with your covers for sure. Best night's sleep will absolutely just help you kind of like get through the night. Highly recommend. And last but not least, we have Serene. Serene it helps with your mood, anxiety. It helps support healthy cortisol, relaxation, especially when we're extremely irritable and we're going through that crazy fluctuation. Highly, highly recommend. And then we have questions. We have reached the end of our live. Do we have any
We
questions?
have, and we've got quite a few of these questions actually.
I think these questions, I think that we went through all of them.
We went through many of them.
Awesome. So let's recap. Perimenopause can start as early as mid-30s. And there are different methods of hormone replacement therapy. You want to schedule an appointment with us. Let's help you find what your solution is. It may not even be hormone replacement therapy. If that's not your cup of tea and you want to get there naturally, like you want to get there through detoxing, you need something more, something different, whatever it is. Let us sit with you. Let us help guide you to where you want to get to. We already know that conventional labs may not, be an optimal choice for you. Why? Because they're just not checking optimized levels. So definitely give us a call, schedule your blood draw, book a hormone consultation. And for those of you who have signed up for this workshop, you will get $50 off of your hormone consultation, which is originally $110. So you just let them know, hey, I came from the hormone workshop. Let me schedule that call. Let me schedule that appointment with Janice. I need my labs read. Something's going on. Something's crazy. So,
Yeah.
Dr. Lubin.
No, I'm just going to recap here that the one benefit of really coming to My Wellness Solutions is just the fact that you get to sit down with someone who is going to listen to what's happening with you, listen to your hormone, your symptoms, go through the intake so that you can then understand that the things and the feelings and the symptoms that you're going through, you're not alone, you're not crazy, and there are real reasons why those things are happening. And we have the ability to address them and make you feel better.
What can we expect from a visit with you, Dr. Lubin?
I don't know. You tell me. People come to see. I
don't know. Amazingness. You know what? Let me answer that. Answers. Period.com. We can expect answers. We can expect clarification. We can expect to walk out feeling like we are not crazy.
We are not crazy. That's for sure. If I can do anything, it's definitely to say we are not crazy. So with that, shall we say goodnight?
I think we're done. So good night, everybody. It was a pleasure. And I hope to see you all soon.
Good night.
Bye.
Bye.